go on ahead and get started. Good evening, everybody. My name is Janet Griffin. I'm the Director of Alumni Relations at NYU Myers, and I am thrilled that you're here with us tonight. During such turbulent times as we're experiencing, we're so happy that you have decided to spend your evening with us, and we hope that all of your families and friends are safe and healthy at this time. And so many of our alumni and faculty are working on the front lines of the COVID-19 pandemic, and we are so proud of them and thrilled that they are just putting their lives on the line every day to take care of their patients and our communities. So we thank them so much. Tonight, we are thrilled to have Dean Eileen Sullivan-Marx with us. She's going to be doing a town hall and just sharing a lot of her perspective on what's going on in the world right now, how Myers has reacted to it, and how things might change in the future as well. So Dean Eileen has been our dean since 2012, and she's also the president of the American Academy of Nursing. So I'm going to go ahead and turn it over to Dean Eileen. If you want to ask questions, feel free to do so in the Q&A button on the bottom of your screen. And when she finishes her presentation, we'll get to as many questions as possible. Thank you so much.
Thank you, Janet, and thank you, Michelle Fung and Ian Headley for putting, and Adrian Berry for putting together this opportunity. And thank you to all of our alumni for joining. I just had a very interesting conversation with someone. You never know when you're going to bump into an NYU alumni. I was on the phone with an elected official in Pennsylvania who knew my mother. And I had wanted to connect with him on some other local issues and related to COVID-19. And he had his chief of staff call me back. And so the chief of staff called me back, and he wasn't sure why I was talking with him, except that representative said, please call her. And I said, it's because my mother worked with the representative. And he says, so I introduced myself, and he said, well, my mother is an NYU Myers alumni. So here I'm talking to someone a few minutes ago, and it turns out that his mother was not only a Myers College of Nursing alumni, but also used to teach on our faculty. So you just never know where these NYU alumni connections take you. They're also very, very important. And as I've always said, I'm not an alum of NYU, but I was taught by many NYU alumni. So I'm very much a product of NYU, as so many people in the world are, regardless of whether or not you're graduates of NYU. The influence is that strong. I hope that many of you might have had the opportunity today to join our virtual celebration of the class of 2020. We held it today on the 200th anniversary of Florence Nightingale's birthday. What better way to do that? It was a little earlier than if we had been doing it in person. We were slated to do it in person May 18th. When we went to go virtual, we decided, well, we could pick any day we want. You don't need in-person venue. So we went for the celebration of Florence Nightingale's 200th anniversary in the year of the nurse and midwife. So you can watch that at any time that you'd like. It's on our website. You just click it and you can download it. It's about 45 minutes. We have the usual number of graduation speakers. We have the pinning ceremony in the beginning, which we did this year by mailing all of the Nursing Myers pins to the new graduates of the undergraduate program who will become nurses for the first time, and they received their pins and a letter from me. And then Dr. Jim Pace, who's our Senior Associate Dean for academic programs, opened up the ceremony, followed by remarks from me, then remarks from President Hamilton. And our Helen Manzer Award winner this year is Dr. Pamela Cipriano. Many of you may know her as a past president of the American Nurses Association and vice president of the International Council for Nurses. She currently is dean at the University of Virginia and gave just lovely remarks and encouragement to our graduates. And then we had remarks as well from the Commissioner of Health for the state of New York, Dr. Howard Zucker, who made just the most poignant and beautiful remarks about nursing and the meaning of nursing today in the state of New York and in the city. And you don't want to miss his remarks. And then your president of the Alumni Association, Monifa Anderson, just hit the ball out of the park with her wonderful welcome to the Alumni Association for the graduates. And so take a look at that, and you can recite the Nurses Pledge right along with us. It's very good these days to be reminded of our pledge and the meaning of who we are and our dedication. So enjoy that ceremony with friends online, or with your family, or just with yourself. It's inspiring, and we need all the inspiration we can have these days. And some people said it felt just like being there. We had graduates who know how to make the most of an online moment, standing next to the TV in their NYU scrubs and pins, and posting their pictures next to the speakers on Instagram. So kudos to you, and I hope a number of you have already been able to view it, but now you can watch it whenever you like. And then on May 20th, the university will hold its virtual celebration for the class of 2020. And we have representatives from Myers, from nursing, in that ceremony as well. And one of our alumni, Adam Hadass, is a speaker. In that moment, I just saw his clip, and it's just fabulous. And I hope that you recently saw the alum magazine, Myers magazine, which is the cover is a picture done by KP Mendoza, who graduated 2 years ago in full scrubs and mask, and one of the more profound pictures of a nurse during this COVID crisis that one can imagine. And because he is our alumni, we were able to put it on the cover of our magazine. So take a look at that. You can look at it digitally. And I think all of those things really speak to who we are and what it is that we've been doing. We met a great deal of challenges. Some of the things that came to us hard and fast right before spring break in terms of number of increase in patients in our clinical sites where students were escalating so fast in March that while we were planning to judiciously plan to go remote and look at the best places for students to learn, almost within 24, 48 hours, it became clear that we just had to remove students from all sites so that we could ensure that students would have best learning opportunities and not be in harm's way. But also, we all realize now that we didn't have the PPE supplies that we should have had to meet the demands that the coronavirus presented to us, and having students in sites when they were trying to preserve PPE didn't make sense. So we went to a number of options. We had a great deal of support from the governor in the state of New York and from the State Department of Education to rapidly turn around modifications and syllabi that would be approved so that students were still meeting degree requirements. We had one turnaround within 8 hours. And those of you who've been in education know that getting a regulatory board to review a change 8 hours is a record, Olympic record for doing that. But the kind of changes we put into place didn't really change the learning outcomes for the students. It just changed the way that we were managing to teach, and those included increasing the virtual clinical simulation experiences, telehealth opportunities, and looking at ways in which we can test learning outcomes that may be better in different ways in a remote environment as we went to all remote classroom instruction. In other words, doing proctoring with large multiple choice exams may not have been the best way to measure learning outcomes as doing some other innovative ways of students demonstrating their knowledge in different ways. And so we were able to quickly do that. And I thank our faculty for being under pressure themselves at a time when New York City was feeling the rapid escalation of the COVID-19 disease, and to many of the students who are now graduates as of this week, who themselves were working as nurses on the front line and taking courses in our master's and doctoral programs, and feeling the pressure of their own lives, and also trying to learn and advance themselves. So it was quite the kind of thing that we had to adjust to very rapidly. While we were doing that, I used a framework that people found helpful in organizational dynamics. You may have heard me speak about this before, when it's almost like when things are going to hell in a handbasket really quickly, what do you do? And so this acronym VUCA, V-U-C-A, V stands for volatility, U for uncertainty, C for complexity, and A for ambiguity, is exactly what we are facing in this pandemic. So it's volatility, uncertainty, complexity, and ambiguity. And we knew that we were in this VUCA moment as it was hitting. And so the ways that this framework shows us a way forward is that when you have volatility, one of the things to do is create a vision. And when you have uncertainty, you create understanding. And when you have complexity, you create clarity. And when you have ambiguity, you create agility. So for vision, we created a vision of excellence, continued excellence, that all the students would complete their academic requirements for the semester in a fashion that met their needs and ours as quickly as possible. We also developed understanding by explaining as much as we could. Communication is still a very, very critical component of any response to an emergency or a disaster. And Keith Olson, who's our director of communications, and his team have been a part of my senior management team on a daily to weekly basis, and working very closely with the university communication team to create understanding not only within Myers, but also within the university. And I want to thank them and Rachel Harrison, who promoted a great deal of communication of the faculty, students, and myself. Rachel works in the university communications and public affairs department to really put our stories forward so that people understand what nurses are going through. And then C for complexity and clarity. So the more we're clear about what we do, the better. Sometimes in these moments of crises, you realize that you have so many sparkling things that you have to address. We've got to do this, we've got to do this, we've got to do this. And until you get clear of, we're not doing this, we're postponing this, but we are doing this. And that really helps move forward out of a very complex situation. And then, of course, as I mentioned, to counter ambiguity, you try and be as agile as you can. And I explained, one way we were very quickly agile is how quickly we went to remote learning online, as well as virtual clinical. The building that we are in at 433 First Avenue is built for all sorts of technology, which we used as we might needed to. But the IT staff at Myers is the best at the university, and I think the best in any school of nursing I've seen. And so that we were able to really quickly move to remote learning smoothly and efficiently. And faculty have found opportunities for different kinds of ways to teach, different ways that Participation occurs. It's much easier to participate by clicking in sometimes than it is by moving from one spot to the next. But there's also things that you can do that very much focus on a different learning outcome. Sandy Kao, for example, who's one of our assistant professors in the undergraduate program, every year is a large class in which students do projects, and then they create posters for those projects, and they often invite me to come and listen. Well, the video project presentations that were created were even more sophisticated than any I've seen before. I think the students have a great deal of technical skill set that they bring to us. And so doing PowerPoint presentations online created a very robust opportunity for them to express what they were learning and what differences they were making in their projects. And I was able to drop in on those projects very easily and share my encouragement for what they were doing. So that, I think, was very important. The other thing at NYU that I think the alumni would want to know about is how much we are a part of everything at NYU. The faculty, the students, myself have been very engaged for years with the university governance. The University Senate of NYU is one of the governing bodies. The executive committee of that organization is composed of the chair of the Dean's Council, the chair of the tenure track faculty council, the chair of the contract faculty, and the chair of the administrative faculty, and the chair of the student council. And that's who governs the University Senate. And of those folks, you have two of your nursing faculty on that Senate Executive Committee. Myself as chair of the Dean's Council this year, and Larry Slater as chair of the Contract or Clinical Faculty Council. And right now, the University Senate decided to suspend its full meetings because of not being able to come together. It's a large body of nearly 130, 140 people. And we used an action in the university governance bylaws for the Senate Executive Committee to be the governing body in absence of a full Senate, so that Larry Slater and myself are among a small group of people who meet weekly or bi-weekly now with President Hamilton to help to steer and manage where NYU is going. And as President Hamilton said, what a great year to have two nurses involved in the decisions that the university has to make. And as chair of the Dean's Council, I am very much involved in many of the university activities that are planning for what it is that we are doing. As we come to the end of a spring semester, what are we planning for the summer? And then the great question of how do we open and in what way do we open safely and continue the mission of the university and the school in September for the academic year 2021, which we do intend to move forward with learning and education. Let me talk a bit about that so that we can understand. The faculty and I have been meeting along with my administrators. Internally at Myers, we've also had leadership committees to look at the task force for COVID-19, and I've included students in those task forces as well, partly because I want to know what the students are thinking and it helps us to understand their experience, but also what a great opportunity it is for them to work with leaders as peers and to see and learn this kind of a management situation. So what we are thinking about for nursing for NYU in the academic year 2020 and 2021 are what I call the 3 S's. S being for seminars, S being for simulation, and S for service. So what we will focus our priority for in the fall, spring, and summer of next year and we will remain remote for the summer this year. But for beginning in September, through those 2 academic years, we will focus our priority on seminars, problem-based learning, case-based learning, in person as much as we can. It may be that we rotate some in-person experiences using social distancing, masks, hand washing in the building at 433 First Avenue. Rotate that as much as we can. But the great priority will be on getting back into simulation, clinical simulation. All the schools of nursing in the country are talking with each other now about best practices, using PPE, using safe practices, but also learning through clinical simulation, both virtually and in person. And we can most likely do that with increased space and hours in our building. In other words, we may convert some classroom space to added sim space, and then keep our large lectures remote only, and which we've been doing anyway. And then finally, the last S is service, which means our in-person clinical experiences, which we hope to continue for our graduate students in the second half of the summer and for our undergraduate students in the fall. And our priority will be on the best way for the students to learn. As many of you know, healthcare systems, hospitals, home care agencies have greatly been changed by COVID-19. Things aren't being practiced in quite the same organized way as it used to be, and the health systems are adjusting. But they've adjusted by creating teams. Many of us remember learning team nursing back in the day. Well, it's almost like that's back to the way of doing things. So students may be assigned to teams more than they will be assigned to a unit. In other words, instead of being assigned to 4 East, you're working with Team Blue, and that will be a new way for students to be engaged in in-person care. But we have a great partnership with NYU Langone Health, with our other partners in New York City, Visiting Nurse Service of New York, etc. And so many of you who are maybe on this call are our alumni who make that work for our students. And I thank you, alumni, who always are there for us to help continue to teach students and bring in the next wave of our graduating nurses, both at the advanced level and at the pre-license level. Our research is continuing, albeit remote. The university put a hold on laboratory research unless it was COVID related for the time being. The university plans to reopen bench lab research June 1st. That's the target date as safe practices are being put in place. Faculty who were able to continue their research through online survey work or virtual have continued that research, but research is more than just running tests. It's also writing the next proposal. It's writing your papers. It's putting new teams of people together, and that has continued. And we're pleased to let you know that the university put funds in place for COVID-19 research, extra intramural funds, and several of our faculty are working on COVID-19 research for nursing. Dr. Amy Stimfel-Wachowski received funds from the university, intramural funds from the provost office for looking at, in her area of work, which has to do with nurse workforce, burnout work, as well as shifts and other kinds of impact on changes in work environment. And Drs. Chris Kovner and Nancy Vandevanter, who did a study during Hurricane Sandy for the effect of disaster on staff nurses, has renewed that work this year with studying nurses who are dealing with COVID-19, and their work is ongoing. And we are increasingly getting interested in studies that have to do with mental health, psych mental health, and many other faculty are looking at their own work as it relates to COVID-19. You may have seen Dr. Maya Kataya-Clark, one of our assistant professors on CNN. She is an expert in renal insufficiency patients and health inequities, and spoke very clearly on CNN about the high risk, even before it became a headline, that health inequities would be seen, great disparities for this particular illness. She was speaking to that through social determinants of health and other issues for African American populations. So we've been very, very active with research opportunities. And as president of the American Academy of Nursing this year and next, it's given me a visibility not only to highlight the work of nurses, but also to speak for the needs of a renewed effort in public health nursing. We've seen the great work that's been done to adjust to critical care for COVID-19 patients, but I always like to look upstream as a community nurse and a nurse practitioner to recognize that very much what's been missing at this time is a strength of public health service and public health nursing work, and have been working with colleagues that we have in the U.S. Public Health Service Commission Corps for nurses, Rear Admiral Susan Orcega, who spoke at with a panel of her nurses at our Estelle Osborne celebration a few years back, remained very engaged with NYU faculty and with myself, and has reached out to us as her Commission Corps nurses are being deployed to the Javits Center, to the field hospitals in Central Park, and wanted to know if we had mobile learning devices for her nurses who may be caring for ICU type patients in those field hospitals or at the Javits Center, but may not have had up-to-date ICU training because that wasn't their area of expertise. And indeed, there are educational modules out there, plus some new ones that our faculty developed. Drs. Leon Chen and Mary Brennan went to work on that, and within a few weeks created mobile device online learning for non-ICU nurses for ICU, and that was given to the U.S. Public Health Service Commission Corps for their continuing education system for those nurses to load up on their mobile devices. And Admiral Orcega let me know that indeed this was going to be deployed throughout the nation, as she was deploying more of her nurses to the Native American tribal communities, including the Navajo Reservation in South Dakota, where we've seen a spike in COVID-19 cases. So we have a wide reach globally as well. And we've been hearing from our Chinese colleagues in China, helping us to understand better, as well as in Florence, where we have students who have often been on January term courses in Florence at the NYU Florence site, and we have colleagues there. So NYU has been not only active here in New York City, but also nationally and globally. And I'm going to wrap up with those kind of sort of summary comments for the kind of things that we've been doing for the last few months now, and open it up to, I know there's probably a number of questions and and I'll have to have the answers or the comments, but I appreciate everyone spending their evening, beginning of their evening with us. Janet, I'll let you take a look at, are you going to read me the Q&As? You're on mute, Janet.
Thank you for that reminder. So we had a question about fall 2020 and about that incoming class and the decisions that are going to be made, because again, there's just a lot of questions about what will happen in the fall, and wondering if you could speak to that.
Well, nobody knows. And there aren't any answers. So what you do in an emergency is you do contingency. You have to have, well, what if this and what if that and what if that? So what if the vaccine is developed next week and we're all safe? Then we're, you know, as usual. But even going back to being as usual means we have to have a start plan. How do we get the building cleaned? How do we get the staff back? How do we get the courses up? And then the other potential scenario is, what if we need to do some, get started with students in September, but then perhaps we start to see some spikes again and need to adjust. What do we do in that situation? And then thirdly, what do we do if it stays the same as it is now? The curve is reduced, but it's still there. We're still going to have cases. So how do we function in that scenario? So that's all those three and maybe a fourth scenario, or what the university is planning towards. And that means that you have to understand sort of dates to make the best decisions, and then when to communicate those decisions and when to know. So that's why I created a framework, like a good NYU faculty member. It's like, well, what are our priorities? Our priorities in any of those situations are in-person problem-based, case-based learning in seminars. The second one is simulation, focusing on simulation, and then the third, service. And that's what people appreciate the most about coming to the NYU experience, is that that problem-based learning, that simulation work, and then the great learning that one does in the service realm. So that's what we'll be working on. And no one anywhere knows the answer to any of it. As if anyone watched Dr. Fauci today, the best thing we can do is stay humble, because we don't know this virus.
Right. Another question was, have you considered classes on the weekends for the upcoming year?
I think everything is possible. But it may be that the entire university has to work together. It's not just nursing. Our building's on First Avenue, but when we have to spread things out, if we need to get so many hours in, yes, it may be a different way of looking at the priorities. Simulation will have to be done in a way that we have to social distance. And so that means you need to spread things out a bit more. And that may be then the hours go longer. And that may be that you don't get simulation for everything that you might have gotten it for before. And our simulation was so strong and so good that we would add hours just to be value added. Well, I'm not adding any more hours. We'll do the required hours, because we just have to make sure we get the required hours in. And that may mean doing some things in different time periods, or it may be doing things in a more concentrated time period, so that you do your clinical experience on an inpatient unit over every day for 3 weeks, like as an executive. And then we move classes to the 3 weeks afterwards. So you're doing it, rather than stretching it all out 2 days a week clinical, you're getting clinical in 3 weeks. And we know that works pedagogically. It's just that we tend to do it one way or the other, but it doesn't mean that it's worse or better learning. It's just a different way of learning.
Right. Okay, next question is, what will the future of public health nursing look like? And will Myers do anything to further encouraging students to pursue public health nursing?
So public health nursing, I've been interested in public health nursing my entire career. So one of the first questions I always bring up is, and people ask, well, where are the jobs in public health nursing? And if you work back, I mean, we've lost public health nursing in the United States because it's been defunded by the government since the 1980s. And so when you try and teach it, you do not have people to show students, this is what a public health nurse does, except in certain places in the country, like the U.S. Public Health Service Commission Corps. And so there is a part of the Affordable Care Act that included a reserve corps for the U.S. Public Health Service Commission Corps, but it was never funded by Congress. And that means that just like the military, you could sign up to be a reservist as you are in the military and do 1 weekend a month, but then be available to be deployed. And that deployment would be, you would be able to maintain your job when you returned from the deployment. So that reserve clause in the Public Health Service Act and the Affordable Care Act has been pulled out by Congress, and I hope will be passed as one of these stimulation packages that are coming through, response packages. Because if there was a reserve corps, there would be more interest by nurses to have jobs in the public health service. And that's at the federal level. And, you know, we need to re-embody those former regional public health service sections that nurses had responsibility for. And then you have city localities as well as states where nurses used to have assigned jobs for the community public health service, but those positions have essentially evaporated. And you can see the absence when we're called now for being on committees at the city and state level, where there isn't a regularly assigned public health nurse department. And so that's one of the first things. As a society, we need to make sure that we're absolutely funding those types of positions. And then you develop a workforce. Now at Myers, we've had a dual degree with the College of Global Public Health when it was an MPH program at Steinhardt, and now that it's an independent college. So students can get both a degree in nursing and a master's in public health. And our undergraduate and a number of our master's programs can do a minor in public health by taking those courses. So I think those have been very popular. But when students finish, they may or may not find places to apply population-based care, except as they think of it as primary care or in psych mental health. So I think that both of those things are going to have to take place. And I'm encouraging us through the American Academy of Nursing to in some ways resurrect public health nursing, but also to create enough of a workforce that people have the skills to really be active. And it's public health is not, you know, something you call community health, which is home care, which is still individual care of people in their home, or for a disaster preparedness, which is one type of population health understanding, public health understanding, but disaster management is only one piece of public health nursing.
Thank you. All right, the next question is, how does COVID-19 affect nursing admissions, and particularly students from abroad? And do you expect an increase or a decrease in admissions?
We're not expecting a decrease in admissions. Usually we see an increase in admissions for following disasters. And this may be slightly different because of the huge economic the economic effect of COVID-19 on people and families in terms of traveling, in terms of what will the resources be for people to continue education. So we, looking at our budget, said, well, perhaps there might be a slight decrease in the amount of people who might be coming through for master's programs because nurses will be so busy still into the fall. But just a minor adjustment to be very conservative in our budget. However, we've already seen an uptick in applications and interest in master's programs, and we've already seen an increase. The first deposit that was made this year when the acceptances are mailed out to students at NYU. All of the many thousands of notices that go out to say you've been accepted to NYU, congratulations, across all of the majors at NYU, all of the schools. The first deposit that was recorded that morning was from a nursing student who had put their deposit down to come to Myers. And I think that speaks to what we usually see. People will return, and people will want to come into nursing, and they'll want to come into NYU nursing.
Great. You had mentioned one of the faculty members who is doing the research on chronic kidney disease and how health disparities are really a big piece of that research. Could you talk a little bit more about the work that all the faculty are doing on health disparities and how it's affecting this pandemic and during this pandemic as well? Because I know there's a lot of faculty members working on health disparity research.
Well, we have a Center for Precision Health and Health Disparities that's led by Gail Melkus, our Vice Dean for Research, Vicki Dixon, Joyce Anastasi is faculty in that center. I'm probably forgetting a few other names, Allison Bordestrasse. And that is a Precision Health for Health Disparities Research Center. It's a P20 NIH funded. And that, that particular research center not only conducts research with pilot studies, but also shares research collaborative information with monthly interdisciplinary collaboration work, also helps to develop new research studies in that area. So we're very proud of that particular center, which was one of the first peace centers that NYU had from NIH. We had the Cedar Center, Center for Drug Abuse and HIV/AIDS Research, which is now in the College of Global Public Health. But this is our first one from National Institute of Nursing Research. And so that's been very active. And that means that our faculty who are doing research in other areas can tap into the health equity resources and knowledge that are part of that center. And then our faculty also are attuned to the differences and are using their knowledge to teach in, whether it's in the master's programs, the doctorate of nursing practice, or the undergraduate program. I mentioned in our graduate celebration today that Dr. Mimi Niles, who finished her PhD this past year at NYU Myers, received the NYU Health Dissertation Award for all of NYU. And her work was looking at health disparities and health inequities for women in childbearing situation. She is a nurse midwife herself and conducted this research related to maternal complications and maternal experiences among different groups of people.
Would you be able to talk a little bit about the work that you were doing with Representative Carolyn Maloney on the Student Debt Forgiveness for Frontline Healthcare Workers Act?
Great, thank you for that question. Representative Carolyn Maloney is our representative on First Avenue, and she is very interested in the Rory Myers College of Nursing. She's visited our college, she's met with students, she stays very engaged with us. And she was so moved when she was meeting with us last year about the financial loans that our alumni have to carry and our students carry, so that when this COVID-19 situation occurred and looking for what is important to help the burden on frontline workers, her legislative staff got in touch with NYU Government Affairs, Steve Hoyer, and myself to say they wanted to write a separate piece of legislation to do loan forgiveness for frontline healthcare workers, including nurses, physicians, and other healthcare workers, because I did mention to her, don't ever forget that on this front line in that critical care situation, it's respiratory therapist, and then ultimately a physical therapist and occupational therapist who get involved in this kind of care. So they have written a bill to support that, and for giving loans for people who are frontline workers. And she held a press conference last week during Nurses Week, and announcing that bill that was introduced. And myself and one of our current students, well, no, it's a current alumni, Hirschkopf, was on and spoke very eloquently. She is a master's alum who's currently a DMP student at Penn. And she was able to speak to the meaning of getting that kind of loan forgiveness. And that was a very powerful press conference.
Great. We have a board member that has posed a question. Is there anything in particular that you see that the alumni board could do to assist the college at this time?
Well, I think that the alumni board has been so wonderfully supportive, expressing your spirit for Myers and your spirit within NYU for nursing, I think is incredibly important. And I think that reminding people to give back is very, very important, and that there are ways to make your mark as alumni, and also sharing your stories, as Janet's been doing so wonderfully through the alumni board and through the Alumni Association at NYU. But then we can take that and share NYU stories that go farther. And so alumni have been in New York Times pieces. They've been part of the social media tweets, and I think that's just fabulous, because that shines an example out to so many people who aren't part of NYU yet, but then who do want to become part of NYU, become a part of who you are. So thank you for all that the board does. You're a great board.
All right, well, we have come to the end of our session, and again, Dean Eileen, I want to thank you so much for being with us here tonight and just sharing all that's been going on at NYU Myers over the last few months, even though it seems so much longer than that.
I know.
It seems so much longer, but thank you for your leadership in all of this as well. And again, to everybody that has tuned in tonight, we appreciate you being here so much, and we hope that you stay safe and healthy. And we have one more lecture, faculty lecture, coming up this month, next Wednesday night on May 20th, about disaster preparedness with Professor Teresa Bucco. So I hope that you tune in for that as well. So good night, everyone, and have a wonderful week. Thank you.
Thank you again. Good night, everybody. Stay well.